Hi friends, welcome to nursinggillfish. I think all are preparing exams. So today let's see the Aiims Norcet 6 question paper. First question, normal compression to ventilation ratio. First option 30 is to 2. Second option 15 is to 2. Third option 2 is to 30. Fourth option 15 is to 1. Actually, what is the question? Normal compression to ventilation ratio. So actually what they are asking during CPR, what they are going to do for it. Okay, fine. So what is the ratio we are going to give? Yeah, 30 is to 2. It is 30 is to 2. That means what is that? Compression will be 30 and ventilation will be 2. So what is the correct answer? Option 1 will be the correct answer. Okay, fine. Move on to the next question. Second question, while using a cardiotocogram, the given fetal heart rate to uterine contraction relation shows the fetal heart rate gradually decrease and return to baseline, but the nadir of the deceleration occurs after the peak of each uterine contraction. So what is that? It is option 1 yearly deceleration, option 2 late deceleration, option 3 variable deceleration, option 4 acceleration. What could be the correct answer? Can you guess it that? Yeah, actually what you are going to do that using cardiotocogram. Okay, they are going to analyze the fetal heart rate, uterine contraction. Okay, the fetal heart rate, what is going to be happen, that it is usually going to be decrease. So FHR, what is going to happen? Decrease. So decrease, return to, again it's going to be normal. So what is the order of deceleration? That is late deceleration. So option 2 will be the correct answer. Okay, got it now? Okay, move on to the next question. Contraindication of nasopharyngeal airway is nasopharyngeal airway. So option 1 skull base fracture, option 2 sedated patient, option 3 unconscious, option 4 during dental procedure it is. So what is that? This is a nose. So what is we are going to do the procedure of what is that? Nasopharyngeal airway we are going to use. So what is that? It is which one is the contraindication for nasopharyngeal airway? That is skull base fracture. Option 1 will be the correct answer. Next question. Complication of high flow of ventilation. Option 1 aspiration, option 2 pneumothorax, option 3 diaphragmatic hernia, option 4 COPD. Actually what is the question? High flow of the oxygen, that is ventilation. So what is going to happen here? See, this is a trachea and it is a lungs, it was coming. If you are giving the more ventilation, so what is going to happen? It is enlargement of the lungs it is. So what is going to be happen? That is pneumothorax. That means what is the correct answer? We are going to accumulate the air in the thorax cavity. So that is why option 2 will be the correct answer. Pneumothorax will be the correct answer. Okay, fine. And if you want any question paper or maybe Aiims Norcet endless question paper, you can watch what is that? It is YouTube channel and also Nurse Genius app available. You will get more questions also, and you have a mock test. Everything will be there. You can kindly watch it. Okay, fine. And next question number 5. Identify the FiO2 route in the given Venturi mask it is. See, this is a Venturi mask it is. So you know Venturi mask, what is the purpose? We are going to be given the oxygen saturation it is. Actually they are given the color code here, but it is not visible for that. Okay, usually what is that? Option 1 40%, option 2 31%, option 3 60%, option 4 28% it is. So what is that? It is correct answer is 40% will be the correct answer because they are given the Venturi mask it is 40% FiO2 it is. So option 1 will be the correct answer. Okay, fine. Next question. A patient is having calcium level 7 mg per deciliter. Identify ECG changes in the patient. Option 1 T-verve insertion, option 2 prolonged QT interval, option 3 prominent T wave it is, and option 4 peak UV witness. So what is the correct answer here? So the patient is having high calcium. It is going to be 7 mg per deciliter. So what is the presence of the ECG changes will be there? Yeah, prolonged, what is that? We will get a prolonged QT interval it is. So that will be the correct answer for this. Okay, fine. Next question. Identify an abnormality seen in the patient pH 7.25, PCO2 40 and HCO3 22, sodium 150, chloride 100. So what is the correct answer for that? It is option 1 metabolic acidosis, option 2 respiratory acidosis, option 3 metabolic alkalosis, option 4 respiratory alkalosis it is. Actually what is the pH? It is 7.25. That will be normal, but the CO2 it is going to be 40 it is, and also it is for the carbohydratic acid it will be 22. So that means we can make further it is related to what is that? It is respiratory part of this. That means respiratory acidosis will be the correct answer. Okay, fine. Next question. Move on to the next question. During suctioning, the patient complains of respiratory distress. Action should be, the first action should be, what is that? Okay, so what is that? Immediately remove suction catheter, suction rapidly in 5 seconds and remove the catheter, call senior nurse, call doctor. So what you have to do for that? What is the correct answer? So whenever the person is having, what is that? It is during suction you will get a respiratory distress it is. So what you have to do? Shall I call the doctor or nurse? That should be wrong. Suction. Yeah, what you have to do? You have to do the immediately remove the suction catheter from the patient. So that means what is that? Option 1 will be the correct answer. Okay, fine. Because otherwise what will happen? It will be make a more breathing difficulty. So after removing the suction you must be apply the oxygen. That should be, you don't forget, you have to administer the oxygen also. Okay, fine. Next question. The earliest symptom of hyponatremia. What do you mean by hyponatremia? That is, it is related to the sodium. So sodium is going to be decreased. So that is a question it is. Okay. Option 1 fatigue, option 2 ataxia, option 3 thirst, option 4 weakness it is. So what it is coming for that? It is, so whenever you are getting the decrease sodium in your body, so what it is coming? Yeah, fatigue. So option 1 will be the correct answer. So we can move on to the 10th question. The earliest sign of hypocalcemia. Okay, what is the question? The earliest sign of hypocalcemia it is. Option 1 twitching, option 2 negative soustic sign, option 3 weakness, option 4 exaggregated TTRS it is. So whenever the patient is getting hypocalcemia in your body, so what is coming it there? Twitching of the muscles it is. So that is why option 1 twitching will be the correct answer. Actually soustic will be the, it is a correct answer for that, but they are given negative. So that is why it is wrong, and the weakness will be wrong for it. It is. So that is why twitching will be the correct. Usually we get a twitching of the muscles in your body. Okay. Next question. Okay, 11th question. The patient has vitals BP 120 per 66, pulse 88, SpO2 99 and respiratory rate 23. This patient should be classified in which triage it is? So option 1, what is that? Red color. Option 2, yellow color. Option 3, green color. Option 4, black color. Actually, what is the question? The patient is having only the pulse normal, SpO2 normal, respiratory rate only it is needed 22, but the only the BP will be some differentiation of this, it will be low it is. Actually, there is no priority for this patient. It's coming under, what is up? The priority will be, it's not a red and low. It is only the green color, because The green indicates that everything will be normal, somewhat it is needed for the patient it is. So that is why option 3 will be the correct answer. 12th question. The patient is having temperature 104 degree Fahrenheit, BP 140 per 90 it is, and for the respiratory rate 28 per minute, and pain scale is 5. Which factor you will primarily manage this patient? You just confirm it. The temperature, what is the temperature? It is 104, BP 140 90, respiratory rate 28. The pain scale also 5 it is. Okay, fine. Now option 1, temperature 104 degree Fahrenheit. Option 2, BP 140 per 90 mmHg, and respiratory rate 30 per minute, and option 4, pain scale is 5 it is. So here, what is the factor primarily managed in this patient? It is, what is the priority you have to give for this? So somewhat everything will be normal here. Only the temperature is rising. So first priority is temperature. So first question will be the first will be the answer for this 104 degree Fahrenheit it is. Okay, fine. Next question. The patient has temperature 103 degree Fahrenheit, heart rate it is 110 per minute, respiratory rate 23 per minute, BP 132 per 66 mmHg. Which factor you will primarily manage in this patient it is? So what is the temperature? It is 103, heart rate is 110, and respiratory rate 23, BP 132 per 66 it is. So what is the priorities needed for the patient? As previous questions we have seen the temperature, and for this patient what we have to do for this? Here also you have to monitor for which factor will primarily manage this patient. That is also, what is that? It should be the BP, because the BP is going to be 130. So option 4 will be the correct answer. Okay, fine. Next question. According to ABC, which of the following describes improper cardiac circulations? So ABC means you know that airway, breathing and circulations. Okay. Option 1, hypotension. Option 2, diminished pulse. Option C, that is 3, tachypnea, and CRT less than 3 seconds it is. So according to ABC, what they are saying, which will be the correct answer? What is that? It is, what should be coming? It is diminished pulse, hypotension, tachypnea. What is coming? So which one is improper cardiac circulation? So cardiac means related to, what is that? Heart rate. That is improper pulse it is. So that is why option 2 will be the correct answer for this questions. Okay, fine. Now next move on to the 15th questions. During IV administrations, which of the following drug causes extravasation and damage to this? Okay, which site it is? Damage to which site? So what is that? Option 1, diazepam. Option 2, epinephrine. Option 3, phenytoin. Option 4, ranitidine it is. Okay, what is the correct answer here? So we are going to administer which drug? We are going to administer IV. So at the IV drug, what is going to happen? Extravasations. So what is coming? If you are coming extravasation means which drug is going to be caused? Yeah, what is that? Phenytoin. So option 3 will be the correct answer. Okay, fine. Next move on to the 16th questions. The trans-illumination procedure is done with option 1, vein puncture, option 2, angiography, option 3, blood culture, option 4, bone marrow aspirations. Usually for which procedure we are going to do the trans-illumination? You know what you mean by trans-illumination? Yeah, what is that? During the, just like a x-ray, it was some just like a green light, like a green sheet, we can make it on this and we can visualization of the vein it is. So usually for what procedures we are going to do this? Yeah, trans-illumination. That means it related to the. So what is the correct answer? Option 1 will be the correct answer. Next, 17th question. In a 3-year child, which of the following is the best complementary feed that can be given to this child? It is. So what type of food we have to give for the child? One is mashed banana, dal rice or fruit roast or boiled soft carrot. It is. Which one you have to provide for the baby? That is a 3-year child. See, fruit juice and the fruits we are giving for the infant. Soft carrot, that is also mashed banana. So which type of food we have to give for the 3 years? The child is 3 years of age. So need a healthy baby. So what you have to advise? Dal rice. So what is that? Other thing will be, what is that? Dal we have to administer dal rice. That will be the correct answer. So what is that? It is option 2 will be the correct answer. So next move on to the 17th questions. A child is CPAP and is hemodynamically stable. Which of the following the best complement? That means which of the following is the best method for feeding the child? It is the child is under CPAP means what is that? The child is on ventilator. So when your baby is on ventilator, can you able to take the food? Not possible. Baby is on ventilator. That means can you able to feed the baby? Not possible. Breastfeeding, cup feeding, IV fluids, nothing. It's not possible. Only the NG2 feeding only advisable for what is that? CPAP baby it is. So that is why option 2 will be the correct answer. Okay, next move on to the another question, that is 19th questions. In a 4.5 mm ET tube, what size of suction catheter used? What is the size? 4.5 mm it is. That is a mm. So usually for the suction catheter, other tubes and all, they are going to measure in the French. That is called it as F4. Okay. So what is that? Option 1, 10 French. Option 2, 12 French. Option 3, 15 French. Option 4, 18 French it is. So what we have to do for it, it is the size of the catheter will be 0.5 only. So what is the 0.5 means? What we have to use it? Yeah. What is the size? 10 French it is. So option 1 will be the correct answer. Okay, fine. Next move on to the another question. Question number 20. WHO, that is World Health Organization, declared COVID-19 a public health emergency on which date it is? That is 13/1/2020. Option 2, 31/2020. Option 3, 31/01/2020. At last 21/2020. Usually actually that COVID was started in which, that is December 2009, and 2020 in the Jan month it was what is that? The Jan it was started. What is a Jan month? They have started the emergency. But when the public health emergency it was started, they are given the public health emergency like a stay order like that. We have started that. It is what is that? That is 31/2020. Don't confuse it. It is the last day only. So that is why option 2 will be the correct answer. So lockdown was happened, no? That is why. That is the thing, the question what they are asking. Okay, fine. Move on to the next question. If anybody wants it is, you can download Target All exam also. It is everything will be available. So all the questions paper, even all department they are having this. Okay, next question. The normal interval of QRS complex is 0.08 second, and what is that? Second option 0.12 seconds. Option 3 0.16 seconds. Option 4 0.4 second it is. What is the correct answer? They are given the QRS, that is QRS 3 complex they are saying. So what is the correct answer here? They are not specifically QRS 3 complex. So what is the correct answer here? Yeah, 0.08 second will be the correct answer. Okay, fine. Next move on to the another question, that is question number 22. The flow rate of a drug is shown as 50 ml in 15 minutes. The correct flow rate of this drug is, what is that it is? So the flow rate they are given 50 ml per minute it is. So correct flow rate we have to be option 1, we have to apply on the formula. Okay, fine. Option 1, 150 per ml hour. So option 2, 50 ml per hour. Option 3, 200 ml per hour. Option 4, 100 ml per hour it is. So see, we are going to make a calculation, that is IV formula we are going to apply for this. So what is that? The flow rate of drug is they are shown as 50 ml per minute they are given. So we are going to apply this. So what is the answer is coming? It is 200 ml per hour. It is coming. The option 3 will be the correct answer. Okay, move on to the next question. For a patient, the desired dose of a drug is 200 mg per BD it is. The available dose of this drug is 0.1 gram. So the correct dosage for one dose of this drug is. So what is that? They are given the desired dose. Desired dose how much? 200. That is also BD order. That is twice a day. Okay. So option 1, 1 tablet. Option 2, 2 tablet. Option 3, 3 tablet. Option 4, it is a 4 tablet. Actually, what is that? It is 200 mg desired dose. But the available dose, what is that? 1 gram, 0.1 gram they are given. 1 gram means, what is that? It is a 1 gram we are given. So 1 gram we are taken means we have to give a dose in the BD order. That is 200 mg per BD. So that means how many tablet you have to give? That is a 2 tablet we have to be administered for the baby test. Okay, fine. Next question. Desired dose of morphine for a patient is 0.4 mg. Dose available is 1 mg per ml. The correct formulation for this patient is, first answer 0.4 ml. The second option 0.8 ml. Option 3, 0.2 ml. Option 4, 0.3 ml. So what is the formula we have to apply for the morphine? Desired dose. What we want by what we have it is. So what is the patient dosage? It is 0.4 mg. Dose available is 1 mg is available. So we are going to make a conversion. So what is that it is? We are going to make a conversion. So 1 mg, dose available dose is 1 mg. But we have to administer 0.4 mg. So you can multiply into what we desired dose by expected dose it is. So what is that? It is a 0.4 mg. It is 10. So you can multiply this. You will get the answer is 0.4 ml. So what is the correct answer? It is 0.4 ml. Option 1 will be the correct answer. Okay. Next question. I think you have understood this question. Move on to next question. An asthma patient comes to emergency with complaints of wheezing and chest pain. What should be the flow rate of oxygen for this patient? It is. So the patient is coming for wheezing and chest pain. You just understand the question. What is the patient is having? Wheezing and also chest pain it is. So the flow rate, the option 1, 2 liter per minute. Option 2, 5 liter per minute. Option 3, 10 liter per minute. Option 4, 15 liter per minute it is. So how much you have to administer for the patient with wheezing and chest pain? Usually we have to administer, what is that it is? Or how much we have to administer? 2 liters per minute we are going to be administer for the patient. So that is why option 1 will be the correct answer. Okay, fine. Next, move on to the another question. In a patient, apical pulse is 80 per minute and radial pulse is 65 per minute. Identify pulse deficit it is. So what is that apical pulse? That is 80 and another pulse is 65. So what is the ratio it is coming? Pulse deficit, what is that? It is 80 minus, you can 65. So pulse deficit. So how much it is? 15. So option, what is the correct answer here? Option 15 is coming. That will be the correct answer. I think I understand the question and answer. Okay, fine. Move on to the another question. In a newborn Apgar score at 1 minute in 7. Okay, that means what is that? Apgar score we are watching in the 7. First 1 minute is 7. And a nurse found that the baby mouth corner is stained with secretions of meconium. What is the next best step we have to do for it? Okay, so option 1, prefer for resuscitation. So actually for the baby score is 7 and the baby mouth corner is secretions they are having. Okay, the option 1, prepare for resuscitation. Option 2, inform physician. Option 3, perform the suction of mouth and nose it is. Option 4, perform the routine care. So what you have to do this? What is the main remedies? The baby is having secretions means what is the immediate action for every nurse we are going to do for it? That is what is that? Perform the suction of the mouth and nose it is. Whenever you are going to do the suction, where you have to do for it? That is priority to the mouth only, not for nose. So keep it on your mind. Whenever you are going to give any suction to the baby, first you have to do in the mouth because the secretion from the nose is coming to the mouth only. If you are going to do the nose, that time the secretion will go inside the lungs. So that is why you have to give the mouth. So mouth only the first priority we have to do for it. Okay, fine. Okay, next question. 28. What is that? Functions of zinc in management of diarrhea is option 1, decrease appetite. Option 2, resolves abdominal cramps. Option 3, maintain hydrations. Option 4, prevent routine care. So actually, sorry for that, prevent indurations it is. Okay, so what you have to do for that? The baby is having zinc management. So that is a diarrhea, the baby is having this. So what we have to do for it? Whenever anybody is having the diarrhea, so what is going to give? We are going to give the ORS. Otherwise, what is that? Fluids. So that means what is that here? Maintain hydrations. Hydration by ORS or maybe the any other oral fluids we can administer. Okay, so that is why we have to administer for the. A child is having diarrhea, shows sunken eyes and yearly thirsty. When milk is provided to the baby, what is that? It drinks eagerly. Which type of dehydration in the patient it is? What is that? Actually, the baby is having diarrhea. The first you will understand the question. The baby is having diarrhea. Okay. Option 1, mild dehydration. Option 2, moderate dehydration. Option 3, no, severe dehydration. And fourth, it will be normal. Actually, it is not a normal. Okay. The baby is having diarrhea. But increasingly, eagerly it was eating. So what it is coming here? The baby is having shrunken eyes also. That means what is that? If it is sunken eyes is coming means what is that? It is a moderate dehydration. So correct option is option number 2 will be the answer. Okay, fine. Okay, we can move on to the another question. According to the WHO, that is World Health Organization, what is the management for second stage of labor? Okay, option 1, pushing with Valsalva maneuver. And option 2, monitoring the fetal heart rate. Option 3, perineal massage. Option 4, emergency C-section it is. According to WHO, actually what is that? Second stage of labor. Pushing Valsalva maneuver, monitoring fetal, which is very emergency for this management. Yeah, we are going to check the fetal heart rate. That is very essential. So that is why option 2 will be the correct answer. So according to WHO, which will be the correct answer? Option 2 will be the correct answer. Okay, so move on to the next question. The patient is having hyperventilation and CO2 level is below normal range. And priority nursing management in this patient is option 1, proper back breath. Option 2, give oxygen directly. And option 3, inform the doctor. Option 4, give sedative. Actually, what is the question here? Low level of carbon dioxide. The carbon dioxide is low, so what we have to give? A rebreathe bag. Rebreathe means what is that? The bag with contents of the polythene cover it is was coming. No rebreather mask. Amber bag like it is a rebreather in this attached. So another question it was coming. I'll show that. Okay, rebreather mask it is. So the bag it is. So that is why you have to give proper back breath you have to administer. Option 1 will be the correct answer. Okay, fine. Next question. Identify the ECG given flow it is. Identify ECG given flow it is. Option 1, atrial flutter. Option 2, atrial fibrillation. Option 3, sinus tachycardia. Option 4, normal sinus rhythm it is. How it was looking? Can you see this? The picture it is looking like that. Any changes was there? How we can able to identify? Yeah. So see the you can look at the pictures in the ECG. What changes was there? Actually, so everywhere the P wave started here, the QRS complex, and this it will be different. You can see under long P wave also it is coming. So that is why sinus tachycardia it is. PQRS complex will be different it is. So here it is sinus. Sinus mean before starting the tachycardia is coming. That ways it's a what is that? Sinus tachycardia will be the correct answer for this question. Okay. Next move on to the another question. The position for doing lumbar puncture is the left lateral, option 2 right lateral, option 3 Fowler's position, option 4 prone position. What could be the correct answer? Can you guess it that? What we are going to do this lumbar puncture. Lumbar puncture when you are going to do in this which position we are going to do for the lumbar puncture. So which is a comfortable position it is? Yeah, lumbar puncture we are going to in the left lateral position. That will be the correct answer. Okay, fine. Next move on to the another question. We can do in the Fowler's person, but it was who is not able to sit properly. For this person we can do in the Fowler's also. Okay, fine. But the best position is left lateral. Next question. Contraindication of nasal intubations. So option 1, conscious patient. Option 2, fracture of base of skull. Option 3, patient with limited mouth opening. Option 4, intraoral mastitis. What is the correct answer here? Contraindication of nasal intubation. So which one is correct answer? Base of skull it is. So the who is having the fracture? Who is having the fractured cymbal? So who is having the fracture? Which one is? So contraindication for nasal intubation, that is NG. Okay, fine. Next question. 5. Identify this instrument. You know the instruments. Option 1, Alice forceps. Option 2, Valsallam. Option 3, what is that? Cittal forceps. Option 4, carcass forceps it is. So how it was looking there? Valsallam forceps it is. So what is the correct answer? Valsallam forceps it is. Okay, fine. Next question. Identify route of drug administrations. Option 1, subcutaneous with Ejetrack. Option 2, IM with Ejetrack. Option 3, IV. Option 4, intradermal it is. Usually we are going to give the identify route of drug and infestations. We are going to give all the things. Usually which one we are going to use it? IM, IV, Ejet. That is a Ejet indicate it is a deep IM injections. So we are going to give vitamins and iron injections and all in this only. So what is the correct answer? That is option 2, IM with Ejetrack will be the correct answer. Okay, next to move on to the another question. Maximum Bharata Ratna award were given in which year? So how many people are getting, that is so many people are getting the award. So during this, what is that, which year is given more award for the persons? Okay, option 1 1999, option 2 2024, option 3 1989, option 4 2022. So what is the correct answer here? 2024 will be the correct answer, because in this year we are given more award it is. Identify the odd one it is. What is that? Option 1 cream, option 2 butter, option 3 ghee, option 4 oil it is. Odd one means which is a different one it is. Cream, butter, ghee, everything is related to the milk and related to the milk product it is. Okay, fine. Only the oil which will be different. So the option 4 will be the correct answer. Okay, fine. I think you will also come to know very easily. When you are preparing the questions paper, first you read the questions thoroughly. So many times I was telling who are all writing for the exam. So you have to read the questions thoroughly, then go for the answer. If you doesn't know the answer, please try to skip the questions, because don't need to get a negative marks it is. Okay, fine. Okay, next question. Core body temperature can be measured using all of the following methods except, okay, option 1 oral, option 2 rectal, option 3 temporal artery, option 4 esophageal artery. So what is the correct answer? Where you are going to check the temperatures, core temperatures. So but it is except, see, oral, rectal we are going to check. Mainly what is, we are not going to check it, even esophageal. But temporal artery we won't check it. So option 3 will be the correct answer. Okay, fine. Move on to the next question. In 35-year-old female, USC 2mm mass and CA 125 is reactive. That is, CA means it is, you know that everyone, cancer. Okay, what is the diagnosis of the patient? CA 125, but the what is that, year is 35 years. So ovarian cancer, cervical cancer, mucosal cancer and uterine cancer. USC shows 2mm mass, where it was there? It is there in the ovary. So ovarian cancer will be the correct answer, because it's showing the CA 125 also. Okay, fine. Move on to the another question, 41. See, if you like this video, please like and subscribe my channel, and also kindly we can post so many questions in the futures. So kindly watch my channel also. Okay, fine. Next question. A 32-week pregnant mother is having the abdominal pain, tenderness and fetal distress. What will be the diagnosis in the patient it is? Okay, so here abrasive placenta, option 1, option 2 placenta previa, option 3 abortion, option 4 ectopic pregnancy. See, actually what is the pregnancy here? 32 weeks of pregnancy, but the mother is having abdominal pain, tenderness, fetal distress. So usually what is coming, if it is a placenta previa, you will be getting the placenta separating from and it will come out. But abortion, it will be having bleeding, but they are not having bleeding, but fetal distress is there. So that is why pain and tenderness and also fetal distress indicating abrasive placenta. So the option 1 will be the correct answer. Okay, fine. Move on to the next question. A 5-year-old baby drank kerosene accidentally. What is the priority of the management in this case? It is option 1 gastric lavage, option 2 nilper oral till help arrive, option 3 induce vomiting, option 4 give activated coracolitis. Actually, for accidentally taken kerosene, but the first priority of the management. Shall I do the vomiting? No, should not do ensued vomiting, activated coracol and gastric lavage. This all the only you have to do what is a nilper oral we have to do for some time. Then only we have to decide what should do for the baby it is, because it's a 5-year-old child. Okay, fine. Next, move on to the another question. How to tie on ET tube on adult patient to prevent bed sores? Cheek to cheek on the ear. Option 2, cheek to cheek over the ear. Option 3, cheek to cheek above the ear. Option 4, cheek to cheek over the neck it is. Usually for ET tube, we are going to apply ET tube. So when you are going to apply ET tube, where you are going to be, what is that? Apply the tie on the ET tube it is. So what we have to do, you have to cheek above the ear. That will be the correct answer for the ET tube adhesive prevent pet sore it is. Okay, fine. If you have seen the pictures, then only you come to know that will be the correct answer. Okay, next question. Look at the pictures, you will understand. Next question. According to IMCNI, danger of sign of sick baby include. According to IMNCI, danger sign of sick baby include option 1, persistent vomiting, option 2, sole and palm are yellow in color, option 3, fever, option 4, watery eyes it is. What could be the correct answer? The baby is sick baby. So IMCI is what is that? Persistent vomiting if the baby is getting, that is a danger sign. The correct option is option 1 will be the correct answer. Okay, move on to the 45 question. A patient in the ward suffers sudden cardiac arrest. Which method of intubation should be used in the patient? Option 1, jaw thrust method. Option 2, head tilt, chin lift method. Option 3, Valsalva maneuver. Option 4, hemorrhage method. Actually, what is that? The patient is having sudden cardiac arrest. Which method of intubation? Usually, whenever the patient is there, we are going to give the head lift, chin lift. Okay, so head should be tilted, chin should be lifted. That is a correct method for what is that? CPR procedure it is. Okay, move on to the next question. A child is on chemotherapy. The nurse should teach the mother about the following except option 1, hand washing, option 2, avoid crowded places, option 3, brush 2 times, option 4, switch bath it is. What you have to do for that? Yeah, the child is on chemotherapy. What should be advised? That is option 4, switch bath will be, we have to advise for the mother. So we have to do for it. Okay, next question. Furosemide injection is administered to a patient for which action? Option 1, a loop diuretic to prevent excessive fluid volume. Option 2, act as ACE inhibitor. Option 3, prevent gastric movement. Option 4, it is a thiazide diuretic. What is the correct answer for this? Okay, whenever you are giving furosemide injection, what you have to do this? You have to give the extra fluid because the person will go for the, what is that? Dehydration. So what is that? We have to administer excessive fluid volume. So that will be the correct answer. Next question. A RTA patient came to the emergency room. In by which method should be the oxygen be administered to the patient? Such as option 1, simple mask, option 2, rebreather mask, option 3, nasal cannula it is, option 4, non-rebreather mask it is. So what type of we have to give for the oxygen administration to the RTA patient? That is road traffic accident patient it is. What is that? Option 1, simple mask should be administered. Okay, fine. Move on to the next question. In 20% of burns patient, how should we check the fluid volume? So weight, option 1, option 2, skin integrity, option 3, strict intake, option 4, height it is. What you have to do, check the, how we have to check the fluid volume of the person with burns it is. So what is the correct answer? That is 20%. That means strict IO chart, that is a strict IO chart should be followed for the patient it is. Okay, fine. At last we can see what is the antonym for monarchy it is. Option 1, democracy, option 2, PRC, Option 3, autocracy. Option 4, kingship it is. What is the correct answer for monarchy? But they are asking the antonym. So what is the correct answer? Democracy. That will be the correct answer. I think you have understood all the 15 questions. If you have any doubt, you can contact the Nursing Jellyfish YouTube channel. Thank you for watching and all the best for your exam.